virus, as some of you folks know it as. And I've got down some questions up here, and I'll just jump right into it and kind of let you go over some things. Is there anything you want to start this thing off with?
So I think many people know me as a doctor of clinical medicine. So by that means I actually practice medicine and see patients every day, which I do at the hospital and the nursing home and the clinic. My role in this situation is less about clinical medicine and it's most about public health. So a lot of the efforts for
Go over some things. Is there anything you want to?
a lot of the efforts for the COVID-19 response are being driven through public health locally across the state of Indiana through the State Department of Health. And then in Fountain and Warren County, we have the Bi-County Health Department, which is the Fountain Warren County Health Department, which is located here in Attica, Indiana. And public health differs from clinical medicine in a lot of different ways. We don't see patients one by one. We deal with the community as a whole. And our motto is basically to prevent disease, promote health, and to protect the well-being of the communities that we serve.
Okay. So I guess with that, so as a lot of you guys know, I posted a status just a little bit ago saying that we were going live, and everyone has a ton of questions on this, and kind of like, what to worry about, what not to worry about. Is it being blown out of proportion? And kind of what the community can do to stay involved and make sure they're on top of things.
Okay, so I'm going to deal with this question of it being blown out of proportion. Um, I would say that I don't believe that it is. The advice that I'm giving to the community is the same advice that I'm giving to my family.
Mm-hmm.
Um, I'm not really the type of person who likes to waste a lot of effort worrying about stuff that I don't think we should worry about because we don't really have time for it. We just need to enjoy life and get along with it. COVID 19, it was first noticed, I think, December 31st, 2019. So, right at the end of last year in Wuhan, China. And since then, it has spread all across the world. And it's made it from Wuhan, China, all the way to, I know there was a case at Subaru Isuzu plant in Lafayette just 2 days ago. And that
Oh,
didn't
okay.
come straight from China. And I don't know where that individual lives, what county, but I know that there was a case there, and there's 12 cases in Indiana. And I think you're all familiar with, or should be familiar with, of the current crisis that's going on in Seattle, in Italy, and other places in the world. So it would be a dream come true to me if this ended up being all blown out of proportion. However, I don't think that it is. We know that the risk for this disease is highest for those that are older or who have what we call comorbid conditions. So, other health conditions that put them at risk for having a worse outcome. And those are things like diabetes and lung disease and heart disease. A lot of the patients that I see. And for older individuals or those with comorbid conditions, the death rate is, depending on the age and the situation, can be as high as 1 in 5 or
Oh,
1 in 6. Now, the death rates overall for the general population, all ages, is between 1 and 2%.
that's what I saw. Okay.
Yep.
Yeah.
And but we know that this disease spreads through people. So it is true that we can both be reassured about this disease. Most of you who get it are going to be fine. And we can respond appropriately to protect those most vulnerable in our communities. And in Fountain and Warren County, we have a lot of vulnerable individuals. Our population is older on average than the rest of the United States. And
And which is another kind of interesting thing. It's hard to find accurate information as well. There's a ton of misinformation out there, and people just kind of flying off of that and then
Right.
reacting from that.
Yeah, and so I would say that it is true. You know, I have this feeling about the internet is that all the right answers are out there, but there's 10 wrong answers for every right answer. So you
Yeah.
got to consider the source. I would encourage you locally, if you want to get your information from fwhealth.org, that's our health department. We are opening up a chat feature where you might be able to ask questions by chat. We also have a Facebook page. Anything that goes on that site that is focused on COVID-19 has been vetted by me, and anything that goes on our Facebook page has gone through our staff, who are all local and who are educated and appropriate sources of information on the information that they post. Now, if you want to go beyond that, isdh.gov, that's the Indiana State Department of Health, cdc.gov, that's the Center for Disease Control, and WHO, or the World Health Organization, they'll give you more of a global perspective. Those are pretty much the only resources I've been using, and I would say, granted, much of the information there is either scientific or very medically based, and so that would be as approachable to the general public. But I would say they do have some resources on there that, you know, I wouldn't say they're certainly not dumbed down, but they are factual information that should be understandable by even people without a scientific background.
Okay. Well, then it's good to know at least kind of where you can point people to real information, because as things change, you know, and those seem to be like pretty static links, and so it's good to be able to find that and at least give the general population, you know, somewhere to look and somewhere where they can go and at least know that they don't have to worry so much about that. Another thing too that I've found is it seems like, you know, as a lot of people do kind of worry that they panic, and it kind of creates that hysteria of, you know, like, oh, I got to go get all the supplies of everything,
Right.
you know. And so, I mean, how is that working out as far as, like, you know, is there anything that the community should be involved with on that?
Yeah, so I do think that the impact that this disease has on our community is going to be a direct reflection of how we respond to it, not only in public health, but how my parents respond to it, how your parents, how my sister does, how my kids do, my niece who's at Indiana University. I would say that their response is going to dictate how this situation plays out. And I'll be a little bit more specific. What we can do about this disease. So, you know, most of my job is clinical medicine, you know, prescribing medications, diagnosing conditions, ordering tests. With COVID-19, we do not have treatment other than supportive care. And by supportive care, I mean oxygen, maybe some fluids, maybe some nebulized treatments to open your airways a little bit more, and then ventilatory support and fever control. That's supportive care. So it's basically, you know, when you got sick at home, it's what good parents can do. Now, some patients with COVID-19 of all ages, but mainly older or people who have weak immune systems or other conditions, they can get really sick. But even in the hospital, the only thing we can do is supportive care. So from a public health point of view, I'm not focusing on treatment for COVID-19, but it's important for you and your listeners to know that we can't do a whole lot to treat it. So we have to focus on prevention. In public health, we have basically two phases. One is prevention, and one is mitigation. Mitigation is a scary word to me, and that means that we take a bad situation and we make it as less bad as we can. We are solidly in the prevention phase right now, and that requires, you know, public health, education, and outreach, and your listeners and everybody in Fountain and Morgan County to do the best they can to prevent the spread of this disease. Now, how do we do that? We can prevent the spread of this disease. I know that you guys have all heard this over and over again, or hopefully you have. I would say we need to stay home if we're sick. That means if you've got a cough, especially if you have a fever, stay home. And I know that, lots of people like to work. They don't want to be the one who calls in sick.
Right.
And my answer is, I love that work ethic. That's part of what's gotten this country as far as it has. But we have to realize in this situation, if you're sick with a fever and cough, you should stay home. If you're thinking about it, you should stay home. If you're uncertain, call your employer. And the employers out there, businesses, tell your employees to stay home if they're sick, because it's just the right thing. So stay home if you're sick. Number 2, wash your hands. That doesn't mean just after you go to the bathroom. This has nothing to do with poop or pee or anything like this. It's a respiratory illness. So wash your hands and wash them appropriately. I am not the best hand washer. Even my 7-year-old will point that out to me. So, well, you didn't wash your hands very well. Yeah. And so wash your hands. Try not to touch your face. We all do it. I think everybody picks their nose sometimes. And you rub your eyes, you bite your fingernails, or nibble on your cuticles, something like that. Try to avoid that. Or if you do, wash your hands before and after you do if it's just irresistible. And then the last thing, it's this weird concept, and it's this maybe the word of 2020, and it's called social distancing. And what does that
Yeah.
What does that mean?
Yeah.
I am not going to get into how do you social distance without offending somebody. I met you today for the first time, and I was like,
I ain't shaking your hand, guy.
And even yesterday, I went to the health department after a long day, meetings and everything else, and I got there. Everybody stayed late so we could have a group meeting, and we did a distant group hug so that we could all feel a little bit better about this.
Seems a little awkward.
Yeah. But social distancing. So, you've heard people talk about you can do elbow bumps. You can, my father's from India. In India, you can say namaste, put your hands in front of you and give a gentle bow. You can bow, you can wink, you can, just smiling. Right. Makes a huge difference. And so, make people aware that, hey, it's not to be offensive. And if you're having a get together, if you're at an event, which that's another thing we'll talk about, and people are entering, then maybe just let the first person know, hey, we're doing this today, and we brought some hand sanitizer, and we're practicing social distancing, trying to keep it as normal as we can, but we want to make sure that we limit the spread of disease here. So that's what social distancing is about. And then in terms of other advice for what the health department has handed out, there was a travel advisory that came out just yesterday.
I saw that.
And I understand that there are strong feelings from a lot of sides on that travel advisory. And I'll talk about that a little bit more. So specifically in the travel advisory, it says we advise against traveling outside of the United States. We advise against traveling outside of the state of Indiana. We advise against gathering in groups of more than 10 people. And there's reasoning behind this. The reasoning is it's not just because Dr. Sharma said so, right?
Although a solid reason.
Right. I know. So some may disagree. But even when I was, putting this advice out yesterday morning, there's a weight that I feel on my shoulders because I know that this is a burden to everybody in the community of me putting this guidance out there. And even people who may not want to follow it, they still are feeling, the impact of this guidance on their life. And people who are following it are feeling the impact. And I tell you, I'm feeling, the weight of this. The reason I recommended it is because we know that COVID-19 is here. Now, let me be specific about that. It is not currently in Fountain and Warren County that we know of. And I will give you up to date, up to this minute, because I have my finger on the pulse of this. We have 5 tests pending for individuals who either live in Fountain or Warren County, and we should have some results within the next 48 to 72 hours on those tests of whether they're positive or negative. Now, there's this concept called Pretest Probability, and it's this idea that we can't just go out there and test everybody, because that's not what the way the tests were designed. We should test people who we think have a reasonable chance of having the disease, because then the test works better. So these 5 people, we had a reasonable suspicion that they have disease, and I'm not going to share any particulars about why. But so their tests are pending, and I'll tell you that I think, statistically speaking, it's most likely that all 5 of these tests will be negative. But we did the testing anyways, because we can't afford to miss it when it gets here. We know that there are 12 cases in the state of Indiana that have been confirmed, and there are only 73 tests in the state of Indiana that have been completed. So if you're testing 73 people and 12 times you get positive results, there's probably a good idea there that we're not testing enough people. And I would encourage, if there are any doctors, emergency room workers, other clinicians, or public health officials across the state of Indiana who hear this, we probably need to broaden our scope of testing beyond the current guidelines from the CDC of what a person under investigation, or PUI, is. I'm not going to get into that here.
That's okay.
But I think we should consider that. And the reason that what the community here can do is so important is because if we slow the spread of this disease, it gives us time for several things. One, it gives us time to develop a vaccine, which is going to take 12 to 18 months. It gives us time to develop medications or antiviral medications like Tamiflu, which does not work on COVID-19, but is effective to decrease the severity of influenza. And those are the 2 treatments, or the vaccine is prevention, and then the antiviral medication, similar to Tamiflu, is a treatment. And those are the 2 things we need to allow time for. Slowing the spread also accomplishes one critical thing. You know that we have one hospital here in the Bi-County area, and I know there are other hospitals around. However, if we have, that hospital, we have 0 ventilators at that hospital. So, we're not going to intubate someone and keep them there. That means put a tube down their throat to help them breathe. And we have, quote unquote, 16 beds, but that's shared rooms. So we're not going to put a COVID-19 patient in with another patient without COVID-19.
Right.
And COVID-19 patients are recommended to be kept in negative pressure rooms where the air is ventilated out so it doesn't contaminate the entire facility. So, and as of yesterday, we had 1 negative pressure room in St. Vincent Williamsport Hospital. And as of this morning, I think this afternoon, we've retrofitted it, so we have 3. But I think the importance of slowing this spread, I don't know that I quite got to it, is that if we slow the number of people who are sick enough that they need to go to the hospital to a trickle, then our medical system, the clinical side of medicine, can absorb it. If they all get sick at once, it will be overwhelmed, and we won't be able to service everybody. And it's not just like you can go to Indianapolis or Lafayette and say, well, I'll go to the hospital there. They have larger populations. If they don't act accordingly, their systems will get overwhelmed as well, and then we won't be able to send you anywhere. So this effort from the community is critical to prevent this. And when we see it here, which I think it will come, we must contain it and slow the spread.
So you think it's not a matter of if, it's when?
Yes.
Yeah. And I mean, it's definitely an interesting point, that you're not just going to be able to go somewhere else, because by the time it probably hits here, they are more than likely going to be dealing with it there as well.
Yep. And you know what? Maybe we should all be glad we live, I wouldn't say in the middle of nowhere, right? I grew up here, you grew up here.
Yeah.
But
at least it's a more rural area.
Right? We're somewhat isolated.
Yep.
And that means that it's going to take probably a little longer to get here, so long as you follow that travel advisory. That's one of the things that has stressed me out the most, is that I can see this coming, because we have a lot of people who had spring break plans, and they were tired of the cold February in Indiana in March, wanted to get out of here,
Yep.
Go other places and then come back. And the risk with that is high. And it's not just where you're going, it's how you get there and what you do between here and there. And then it makes our community, which Fountain and Warren County are about 25,000 people, it makes our community a global community, right? So we just get lots of stuff brought back home that you didn't mean to bring back home, but you did.
Yeah. It's interesting that you say that, because I'm supposed to be in Louisiana next weekend. kind of sweating it now.
Yep. And I encourage you, well, things between now and next weekend are going to change. If you choose to go to Louisiana, I don't recommend it. As your health officer, I advise against it. And if you make that choice to go, you should make every effort to do it as smartly as possible. But I still think it's probably not the best decision.
Yeah. So it's definitely good to hear that, because it just shows the severity of everything. That being said, I probably won't go. I need to go down there. I was supposed to film a Monster Jam event, but there'll be another one, so it's not the end of the world. Man, well, one thing that I did want to say too, that's a little off topic, but as I'm going through some of these comments, I see them coming through here, man. Everybody is very thankful for your time and everything that you're providing for the community, and so I would like to thank you for that as well. And that being said, I did get one that was a question that kept popping up about actual if being pregnant is an issue with that, or if it should be more severe or treated differently.
I would say that when you're pregnant, there probably is a somewhat of an increased risk. We wouldn't consider you to be immunocompromised, but you're having a little bit more physiologic stress on your body. The baby takes up room, and may decrease your lung capacity, and so there probably would be some slight increased risk. Although I don't believe the evidence is currently showing that pregnancy itself would be a particular thing that we would want to target to protect, say, more than people who actually have compromised immune systems or are over the age of 60 or who have other comorbid conditions. That being said, I think pregnancy is such a critical time for so many people, right? There's this promise of life and hope and family, and so my feeling is that I think if you're pregnant, most people who are pregnant or who are married to someone who's pregnant or have that in their family, you protecting yourself and you reminding them to protect themselves are all critical. And I'll remind you, it's washing your hands, don't touching your face, limit your travel, limit groups getting together, and practice social distancing, right? Use that baby bump to your advantage.
Yeah, that's Well, it's really good to hear that. And as I'm going through, I'm trying to watch everybody here. Right now, we've currently
I
got a. Oh, go ahead.
Go
Go
ahead.
ahead. Nope, you're all right.
I do want to say, another thing. So
Mhm.
it's going to happen, and you're going to say, what do I do if I think I have COVID-19?
Yeah.
So I know that's going to happen, and I'm going to say that this is going to change probably within a week. And so I'm going to say right now that you should probably call your doctor's office, explain that you think you have COVID-19 and say why. And I'm going to say that at a minimum, you should have a cough um, and a fever. And I would, medically, we consider a fever over 100.5. If you check your temperature under your arm, don't add a degree to it. Just, I would say, give us the number. And if you say you have a fever and a cough, and that's, and usually some body aches, I would say that's suspicious. Although influenza's here right now, and boy,
Hmm.
that sounds like influenza too.
Right.
So that can be influenza. It can be COVID-19. Um, I think the distinction for COVID-19 risk, as far as we currently know, is if you've been traveling recently, but that increases your risk for flu, especially if you've traveled to a higher risk area. And we know right now that means outside of the country or certain locations in the United States. And I'm gonna give you some of the hotspots that we know, which is Washington State, certain areas of California, New York, particularly one suburb of New York, Massachusetts, and I believe there's one more. I sort of lump Oregon in there because it's right between Washington and
Yeah.
California, which maybe isn't fair. But my guess is that there is community spread of COVID-19. I'm going to dive into some numbers here because I think it's important for you guys, for everybody to realize that these judgments I'm making, part of it's based on my understanding about health and disease. Part of it's driven by numbers. So currently, and this was just updated by the CDC, I think there are 42 deaths in the United States from COVID-19, and there are 1,600 confirmed cases. So if you use the numbers that we have about this disease, between a 1 and 2% mortality, and we have 42 deaths, that should calculate to 4,000 to 8,000 confirmed cases. And death happens later in the course of a disease. So those things putting together give us an estimated number of infected individuals in the United States, probably somewhere between 4,000 at a minimum and 15 to 20,000. So somewhere in that range. That's a large range, but it's a lot more than 1,600.
Right.
And so when we know that, I think it's important. So if you're sick and you think you have COVID-19, you've been exposed to someone who's maybe being tested for COVID-19, or you've been in an area where COVID-19 has been identified, that would be concerning to me. And we should consider testing. It doesn't mean everybody's going to get tested, but you and your doctor can make that decision together. Now, we don't want people necessarily flooding to their doctor's office, because if they contaminate the office, then even the secretary or the receptionist at the office, anybody that you're around, if we think you have COVID-19, needs to be off of work for 14 days. We don't have the staffing here in Williamsport
Right.
to just say, oh, well, we'll pull the next shift in. That doesn't work. So if you think you have COVID-19, you should call ahead, call to the health department, call your doctor's office, sort that out over the phone. And if you're severely ill, right, you can't breathe, you can't get your fever down, you should go to the emergency room or call 911. But if you're doing that, you should call 911 and say, I can't breathe. I'm concerned I have COVID-19. Please send an ambulance. or I'm concerned I have, that bad virus, if you can't remember what it's called. And then EMS, or the emergency medical services, can come. They can be prepared. They can be appropriately protected, because we don't want, one ambulance crew to come if they didn't know what they were getting into and then all be exposed.
Yeah.
And I'm going to tell you what they consider exposed. And that's being within 6 feet of one another, which you and I are, for more than 1 minute without appropriate protection. That means a goggle, a specific fitted respiratory mask called an N95, and a full body gown that protects against droplets, along with gloves. If you don't have all of that on and you're around someone for, more than a minute, you're considered exposed, and that healthcare worker would need to be off or in self-isolation for 14 days.
Wow.
We don't have enough nurses.
Right.
We don't have enough secretaries. We don't have enough emergency room doctors or clinic doctors or nurse practitioners to lose one.
Right.
And you could walk into the emergency room and expose the whole shift, and half the workforce at Ascension St. Vincent Williamsport is out of commission.
Yeah.
So call ahead, call the health department, call your doctor's office, and they can help direct you appropriately. They're going to triage you. That means ask you questions over the phone, get a good idea. Do we need to do testing? Do we not need to do testing? Our goal is going to be to direct testing in your home, right? We're going to say, if you're not that sick, but you feel like you're concerned and we're concerned, we're going to say, stay home. We are going to arrange someone to come to your home and perform the testing there, and then send it in, and you'll be done, and then you just do your TLC the way your mom did, and take care of your symptoms. It'd stay isolated for 14 days, and then if you're in your home and just one person is sick, that's complicated about what you're supposed to do, but there is guidance on the CDC website. So and we have links through fwhealth.org. So use those. If you're sick in your home, so I'm going to give you a specific example. My niece is at IU, and she said, this was a few days ago, so all this information's changed, but she said, oh, IU canceled classes for 2 weeks, and I was planning to go to New York. And then, so if I went to New York, should I come home afterwards, right? Or are Gaga and Papa, am I going to get them sick if I did bring it home? And I think that the first question she should have asked, which she didn't, was, should she go to New York? So we had a big conversation about that.
Yeah.
And even though she's my niece, I still educated her and let her make the decision. And then she talked to her mom, and then she decided not to go. So her New York trip was canceled. But I think it kind of surprised her when she said, my answer to the second part was, if you go to New York, should you come home, or should you stay up in your apartment at Bloomington? And I said, well, I think that's your choice, but it'd be good if you do get sick to come home. All right, you can stay in your house. Now, fortunately, in her house, it's her mom or dad or brother, and no one who's immune compromised or, over the age of 70. And if there was, I would probably tell her not to come home. But in this situation, I said, well, your family's healthy. Why don't you come home, do social isolation while you're at home, meaning you stay in one room, and maybe your mom brings you food, and you can get out and you can go to the bathroom and you can clean those common touch surfaces frequently throughout the day. But then, it's probably better for you. You feel more comfortable being home. Your mom feels more comfortable being home. If you came home and, because some of these college students are going to come home, and I'm okay with that, right? Great. Come home, be close to family. But it doesn't mean it's time to get together with all of your college friends, or, share your germs with someone else. So come home, spend the time with family. If you're not sick, still practice the, good things like social isolation, limit groups, don't touch your face and wash your hands. But if you are sick, stay in your home or walk around outside, and then try to separate yourself between you and your family reasonably. And what I told my niece was that, she's not to go visit Gaga or Papa or Omi and Gigi because it's just, she can always see them later.
Right. Good point. One thing in that too, that so the 14-day isolation, is, is it about 14 days that this thing runs on until it's until it's not transmittable anymore?
Yes.
Or, okay.
Now, different people will shed the virus. That means spread the virus at different rates throughout the disease. But we think that if you're exposed and if you're gonna get it, you're gonna get it within that 14 days. And if we know that some people can surprisingly, or not so surprisingly, depending on how much you know about medicine, get this virus, but just not be very sick from it. Like, oh, I got a little bit of a runny nose, but they can still spread it.
Makes sense.
That's tricky because, do we kick everybody with the runny nose out of everywhere? Well, I don't know that we can. And I don't know that we should, because someone who's feeling really well, doesn't have a fever, has a mild runny nose, well, they shouldn't touch their face, should cough in the crook of their arm, and practice all those things that I keep saying, and social distancing, and their risk of spreading it to someone else would be low.
Got it. Another thing that I was a little curious about, but it sounds like you answered it. So if you do get it and you don't pursue any kind of medical treatment or anything like that, just like the flu, your body will fight it off then? Is
Most people,
Yeah.
yes.
Okay.
Most people. But, some people will die from it.
Sure. Yeah, that was one thing that I was very interested in asking them. And I had a lot of folks that had also asked, so if you get it, what's like the most, and I know you kind of covered it a little bit, but like, I guess what's the most common way to transmit it? I mean, is it just like saliva? Is it just even being in the air?
So we're going to say it's like respiratory droplets. Okay. So small particles of fluid with virus particles in them that come from your nose or your mouth or otherwise that then go to someone else, or they may go on to someone else through the air, or say if you're coughing, you cough into your hand and you wash, but you don't get it all off, then you can touch their hand and transmit it to their hand, and then it's not going to get through their hand.
But through the face, gotcha.
Yeah, they will touch their eyes or rub their eyes or scratch their nose or bite their fingernail, and then it gets into their body.
That makes sense then. I was a little curious about that as why there was no face touching. But okay. And man, a ton of great information. We've got 130 people in here. Is there anything in particular that you would like to tell these folks that are listening? It sounds like the common thing is wash your hands, don't touch your face.
Right. And I would say, fortunately we're in this prevention phase right now. If we can keep this from getting into our community, super. Right? That would be great. And it's going to take everybody working together. And please don't clog up the emergency room. Don't contaminate our doctor's offices or the emergency room, because it would really lead to disaster here, just because, some people say, well, I've got to go to the emergency room, and they go right in. If you think you're sick, and for whatever reason you say, okay, well, I can't get a hold of the office or otherwise, then I would say potentially show up in person, but get a mask on immediately and wash your hands before you touch the door, and notify staff immediately that you're sick. Now, I know Ascension St. Vincent in Williamsport has taken the masks out of their lobby area. They've taken the masks, out of the common areas, and so they're being held right where people would first check in, so you should be identified immediately. So don't sort of go in, go to the bathroom, mill about, get something from the vending machine, and then go say, I'm sick. Go right up and say, I think I need some help. Can I have a mask? And they should be able to help you out. I do want to give some shout outs. uh, I I've been in a lot of communication with many people in the community over the last week, 2 weeks, at least, and I would congratulate and encourage everybody to give our school officials a lot of support. This is a trying time for them, and that's uh, I probably shouldn't say all their names because I'm going to leave someone out, but so Ralph Schrader and Rob Beckett from MSD of Warren County, along with Mary Billingsley over there, they've been great, and Kevin Smith from the Covington schools has been great to work with. Dan Foster, I think, from Southeast Fountain Central, and then Sherry, I think it's Harden from I may have gotten the last name wrong, from Attica School Corporation. We've been emailing all hours of the morning and sharing information and trying to, work together on this in a way to keep people's lives intact and keep people's, health the best that we can. And we realize that this is inconvenient. That's not why we're doing it. We're doing it because we think it's probably judicious use of the information that we have to slow the spread of disease in this community. St. Vincent Williamsport, Ascension St. Vincent Williamsport, with Trina Marlatt as the administrator and Pam Miller as their infection control, have been wonderful supports. And then all the staff at the health department, Kelly Thornburg, Peyton Wilson, Melissa Dismore, Lacey Froge, Eric Haley, and Jenny Eads. And then we've had some volunteers come in and help us too. We are going to be recruiting some more volunteers over the next week or two and having some training. If you're interested, you can, I would say, maybe not call. Email might be best because then we can access that information at our leisure, and then we don't have to take up phone time for that. And we're going to have some volunteer training. You don't have to have medical knowledge. I think that the basics about this disease are a lot of good common sense and basic germ theory that that you should learn in sixth grade health class, or maybe even earlier. And so if you can answer questions, you can figure out what's serious, what's not serious, and you can offer some reassurance. I think it's a delicate balance that we have to act of getting everybody to change their behavior dramatically, but then realize that panic doesn't help with that. And so my hope is that you listening here today and making sure that you're informed of the resources and services that are out there can help inform you, but not spark fear or panic.
It's a good thing. Yeah, it's a very good point. It seems like the biggest issue isn't so much the disease itself, but the panic and just the commotion all the way around of everything, and
So
shortage of workers.
well, yeah. Although I would say that this disease got into one long-term care facility in the Seattle area, and I don't know exactly how many people died, but I think somewhere between 10 and 20 people died in that one facility.
Wow. So yeah.
And so I would say that this is a deadly illness, and it affects all ages. So even in China, where this started, and they have made significant efforts, even in China, it doesn't mean everybody who died was over 70 or
Right.
had a comorbid condition. There was, that 39-year-old doctor who died, right? I don't know his health history, but he looked healthy. And, I'm older than he was. I don't have any medical problems, but it concerns me a little bit. I know that my children are at low risk, but I worry about bringing something home to them. And by low risk, I would say it doesn't mean zero, right?
Right.
So I would say that we encourage everybody, not to roll the dice just because you think your risk is, 0.2%. I would say that's not zero. And,
Right.
0.2%, I don't know, someone's going to tell me I'm doing the math wrong, but if that's, one in, it's 5 times 100, 1 in 500 chance of dying from the disease, well, you still don't want it.
Right.
Right.
Yeah, I'm good on that. Not
Yes.
fighting those odds. Another thing too that I wanted to ask that you kind of brought up a little bit though was the children. So is that a really big deal? Is it more life threatening to children? Is it less? Is it
You
about the
know
same?
what? There, it is interesting, and I am grateful about this statistic. Is that we have found from what we know that the risk for children is less, um, significantly less than for older adults. I would say that infants in their first year of life, we'd prefer them not to get severe respiratory illness. And I don't know the specific rates for them, but I would say once you get to 2 to 7 years of age, those risks of bad outcomes with this disease are pretty low. Um, and I think that that's great. But kids are great at spreading germs. There's some theories out there. Well, why is their risk lower? Coronavirus, which everybody calls this coronavirus or COVID-19. I use COVID-19 because it's a little bit more specific. This other acronym out there, which I don't use because it doesn't roll off the tongue as easily, but that's even more specific. But coronavirus, COVID-19, and that other acronym that you might see out there on some of those websites, they're all the same thing, except coronavirus causes the common cold. So I'll be honest, 2 months ago when I heard this first, I was like, coronavirus? I was like, well, who cares about coronavirus, right?
Right, right.
Because that's just the common cold. But this is COVID-19, so there's lots of different coronavirus varieties out there, right?
Oh,
So
okay.
um, it would be, I don't know if this is a great example, but to say that there are lots of different races of humans out there,
Hmm.
right?
Yep.
But they're all humans, right?
Right.
They're still made of the same stuff, but they're slightly different.
Yep.
And so this one is different in terms of how people react to it. And I think some people have asked, well, how do you die from COVID-19? Well, part of it, you get it, your body tries to fight it off, your body mounts a severe immune response, and maybe is not successful. You get all this inflammatory junk and fluid and everything else in your lungs, and then most people would die from respiratory failure. Right? They can't breathe on their own because the infection just overwhelms their lungs and their body's trying to fight it, but it can't. So, but yeah, we think that kids are at lower risk, but kids spread a lot of germs. And one of the hypotheses out there of why kids are at lower risk is because they get other strains of coronavirus more frequently than adults that might give them some better recent immune memory that would help to fight off this disease better.
Interesting. Interesting. Okay. I had read that, but I actually didn't buy it. And I was like, that sounds like an old wives'
Well,
tale theory there.
it's not proven, right?
Right.
But I would say the logic's there.
Got it. Yeah. Well, you know before me. um, okay. So there are a couple comments that are kind of floating in here, and I don't want to take up too much of your time either. Uh, one thing that let's see here we got. Do you think that COVID-19 is something that we will see make a comeback in the fall/winter like influenza?
Right. So this brings up something that we've discussed in my home. So it frequently. So is COVID-19 seasonal? Is it going to go away when it gets warmer? The answer to that is we don't know. And the more complicated answer is we don't know, but we think it's probably not going to have as much seasonality as influenza. So, and part of the reason we say that is because, well, and I just heard on the radio this morning, right? So Tom Hanks and his wife are both in Australia, where it's summertime, and they both have COVID-19,
Oh,
right?
yep.
So they're they're doing fine,
Right.
right? Don't worry about them. But they both have COVID-19. It is about day 8 or 9 that sometimes you have to worry the most about them. But he's giving daily updates, so if you're really concerned, you can probably check that out. But so COVID-19's in the southern hemisphere where it's more summer, or it's into fall right now. It's in the northern hemisphere in both warmer and colder climates. So it seems to be less seasonal. However, one thing that worries me is, say we get lucky in a way, right? Say it is seasonal and it goes away or seems to go away. That doesn't mean it disappears, right?
Right.
Influenza comes back every year. And then I think the danger there is everybody says, oh, see, I told you, Dr. Sharma, it wasn't that big of a deal. And then it gets away to maybe have more spread in the community that's less detected, and then becomes more rampant in the fall. I don't know whether that's going to happen, but that would be an unfortunate outcome.
I could
So
I can see exactly the path that you're saying, though.
yeah. So let's pay attention. If it does go away, that doesn't mean it's not going to come back, and it does mean that we still have to be cautious. Stay home if you're sick. Wash your hands. Don't touch your face, and practice social distancing. Is this the new way of life? Well, some of those things we should always be doing anyways,
Yeah.
right? And then the whole social distancing thing, I hope that's not the new normal, and we'll just, time will tell.
Great. Well, great to have you. And is there anything else you want to talk about maybe before we jump off here? I don't want to cut you short at all, but I also don't want to take up too much of your time. You're a busy guy.
Yeah. No, I appreciate people tuning in. You be sure to share this with other people. I think it's been a good opportunity for me to get hopefully some common sense knowledge out there. If you're watching this, so today is March 13th, Friday the 13th.
Friday the 13th.
Yes. So if you're watching this, and it's March 20th, realize maybe lots have changed, right? So maybe you need to look, maybe we need to do another podcast if this changes a lot.
I would certainly love to have you come back, and we could do it anytime that, me and you can meet up. I would love to, because as this thing progresses, I would love to keep everybody informed on what they can do, and just the general knowledge, is good to be out there, because it's, like I said before, it's so hard to find the truth, and with all the misinformation, at least having somebody like you that knows what's going on, it's a good spot, and it'll keep, a common ground for everybody and somewhere for them to come back to.
Well, thank you, Brandon, for having me.
Absolutely. Absolutely. And before we wrap this thing up, I would like to thank Logan Leaf CBD. They do help me out, and they send me a ton of free CBD stuff. And they are great folks, and they're a great company to work with, as well as Midwest Roof Restoration. They have helped with this podcast tremendously, and if you are interested in them, shoot me a message, and I'm going to actually start sending people their way very soon. And thank you, Dr. Sharma, because this is a huge help for a ton of people, not just me, but for the entire community as well. And if you are listening to this, please share it. If it's on Facebook that you're listening to it, feel free to share it. Start a watch party. Tag some of your friends. If you're listening to it on all listening platforms, just maybe send it off to a couple of your friends or someone that you might be concerned with that might need the knowledge. So as of right now, I'd say that maybe in the near future, as things change, might be able to do something again. Your time permitting, of course.
Sounds great.
Awesome. Well, thank you guys for listening. Thank you for coming out and doing this. And I will talk to y'all real soon.